Okay, welcome back to another episode of Valued Pursuit. I am Patrick Davitt with my co-host here, Tyler Stegmann. Tyler, how we doing today?
Doing awesome, man. Very excited for episode 8 now. We're moving right along, almost at 10 episodes. So
Yeah, absolutely. So we thought we were wondering about, we wanted to throw this in at some point, and then I have the pleasure of having a co-host here, Dr. Tyler Stegmann, who's a doctor of physical therapy. So we thought, why not dive into a sort of deep understanding and explanation of the power of a physical therapist, what a physical therapist does, and why a majority of individuals who are listening to this, both of us included, at some point will need a physical therapist, if not potentially one right now. And then on that note, when it comes to musculoskeletal injuries, random stat to throw at everyone, the lifetime prevalence of non-specific low back pain is 84%. So that's quite a lot. So 84% of individuals at some point in their life will have non-specific low back pain. When you get to that, 23%, so almost pretty much 1 out of 4 will have chronic low back pain. And then the stats there are like 10 to 12, 11, it was like 11 to 12% are permanently on disability due to low back pain. So Tyler, I'm going to hand it over to you, the doctor of physical therapy.
well, thank you for the introduction, Patrick. Yeah, so we were just chatting and we were saying how we may tie in the kind of the theme of like a concept of one step backwards and two steps forward. And we were thinking, oh, hey, let's talk about like the whole choose PT movement and why you should go to a physical therapist. And now being a doctor to physical therapy, they changed that in 2015. It used to be a master. So now it's 3 years doctorate, not medical doctor or like a doctor of psychology or a PhD or anything like that, but a 3 year doctorate. So the real reason is just because of like their extensive background of the education that you get nowadays. So we learn like everything head to toe in terms of the human body, of every different kind of discipline that you can treat. So anything from like we just said, musculoskeletal to any kind of like neuro uh, condition, any spinal cord, prosthetics, like even burns and things like that. Um, there's just such a like a broad range of things that we get trained in. So if you go and see a doctor of physical therapy, they're really going to be able to give you like kind of a diversified screen and be able to make a referral to another more specific clinician that can help you versus if you go to just like your primary care physician, they may not be able to help you and then they may have to refer you to a specialist, and it's very difficult, as we were just talking about before we started recording, to even get like doctor's appointments now. It could be a month out. You may have to go for more testing. You may have to, I was just actually doing some research too, like that like 31% of like medical costs just for patients to go, if they're not going with direct access in certain states, you can go and see a physical therapist without even going to see your physician first. So you can just kind of walk in, not have a referral or any kind of like script saying, hey, I need treatment for this, and just get assessed by a physical therapist. And there's some sort of things that like are prerequisites, like in New York State, you need to have at least 3 years of experience. So like I'm not able to do that yet because I just graduated in May of 2020 two of this past, so almost a year now, uh, this past summer. And but there are benefits to that. So if someone has 3 years of experience, you can go and not have that script, and you can save yourself, like I just said, some money. You can save yourself even more importantly time. Get treatment faster, so like reduce your pain, get out of pain, improve your mobility, kind of figure out what's going to help you get like a structured strengthening program to like kind of improve your quality of life and get you going. And then you can also go to your, doctor there on after that. Like New York State, you can go for 10 visits or 30 days without a script. Every state's going to be different. So you want to make sure you check with your state practice act for that. But like to go back to what I was saying, like with a PT, we're movement experts. So like we're going to be able to kind of head to toe figure out what's going on. Is it a musculoskeletal issue? Is it a neurological issue? Is it maybe even like a visceral issue, like relating to maybe like a gastrointestinal problem, like with the stomach, and maybe you have to go to a GI doctor. Um, and Patrick and I were having a conversation, and we thought it was something good to talk about because living a valued pursuit. We're all going to eventually run into some issues with our body. And if it is something that's musculoskeletal, or again, like I said, in any of those other realms that physical therapists treat, and those aren't only the only ones, there's tons of other areas that you can go to in physical therapy. It's a very good person to kind of go to first and kind of figure out, like, get educated. And we were also chatting about before, like a lot of these cash-based clinics now, not so much like the big hospitals and like bigger companies are offering like free discovery sessions or like free consultations where you can even go in and you don't even have to get set up like with any kind of appointment or anything like that. You just go in for a consultation for like 10-15 minutes and just meet with a doctor of physical therapy, and they can kind of, have a conversation with you, listen to your symptomology, and listen to kind of the things that like you're limited by, and kind of point you in the right direction of, hey, maybe you are a good candidate for physical therapy, or hey, maybe you need to go to, you know, um, a neuro specified, like a uh, someone who has like their NCS, who's like a neurological clinical specialist, or like there's different like extra things that you can get once you become licensed in physical therapy. There's orthopedic clinical specialists. Everyone has kind of different scopes, and they can make that decision like, hey, you're good for here for musculoskeletal, or it's more of a maybe like a neurological thing that you have to deal with, or maybe it's a vestibular problem. That's another practice in physical therapy with the inner ear and eye, the way that they work with one another with balance and things like that. So it's kind of a really good place to for your time to make sure that you're, again, not like getting bumped around to a bunch of different specialists, getting unnecessary tests, wasting your insurance coverage, and, you know, worst case scenario, really having to spend out of pocket costs on things that may not be covered by your insurance to go to a physical therapist, kind of from the start point of your journey of getting back to your baseline, so to speak. So
So with that, yeah, and that's a fantastic sort of overview of the complexities of a lot of the fields that PTs can go into. So I teach exercise physiology, but a lot of my students who are ex-phys majors are going to go into PT. So I'm extremely familiar with the prerequisites, which are extremely robust. It's just short of or very similar to like going into med school. You have both bios, both chems, both AMPs, both physics, a couple different math classes, a variety of different psychology, other social science classes, et cetera, et cetera, et cetera, medical terminology, all these things that you're just looking to take just to get into that PT school. And then you're just, running the gamut on all sorts of human body understanding and physiological understanding of the movement and clinical and all these different things that you obviously know very well. So when someone is, what would be, I guess, a lot of apprehension of why I might want to go see a physical therapist, and, you know, putting a lot of individuals who might have whatever ailment or pain that exist, putting their mind at ease of, like you said, a lot of what we talk about is take that first step of just taking that step and just going and getting checked out by a physical therapist. So how would you ease someone's nerves and sort of welcome them into the doors? I mean, we had Joe on from Iron Health, and we didn't talk as much about the PT specific aspect. We did a little bit, but it was a little bit more about the business and mindset and things like that. So how would you put someone's, nerves at ease and promote, hey, like here's an advertisement of you're feeling X, Y, or Z, check out a PT, which is cool because that kind of rhymes.
it's a good marketing thing, right? I would say the first thing that comes to mind with me is I just feel like doctors get a bad rep, and there's like a lot of really good holistic doctors. I listen to a ton of different podcasts, like Dr. Hyman and the Wellman's podcast. I've sent some of them to you. Um, and most doctors are just, they're going to prescribe medications. They're going to kind of, you have these symptoms, these medications are going to help kind of mask those symptoms. And I feel like we kind of all fall into that care. And I don't want to say some PTs do that too. I mean, there might be like more of a cookie cutter model for certain. And I think Joe got into that too. Like there's people may see physical therapy in a certain light as well. So kind of both of them, like going to your doctor and getting meds for your pain, and then also like some physical therapy places just kind of doing the same thing, slapping heat or electric stimulation and kind of doing the same cookie cutter approach for every patient. I think the biggest thing is to do your research, like we talked on a couple other episodes, and try and find someone that, even with like doctors and any kind of clinician, like vibes with like what you're trying to, if it's sports or if it's you hike or you're an endurance athlete or you're just like a weekend warrior and you're trying to get back to work and be out of like discomfort. Like try and find something that jives with that and has that kind of model with their setup. And bigger places it's going to be difficult to do that, like in the hospital. But like more cash based places or more private smaller clinics are probably easier to do that. But I think generally like good physical therapy, and I think it's up and coming. I think it's really changing now with it being a doctorate and the education that we're getting. It's just a bio, like we take into account that whole biopsychosocial model and how much like stress and like all these other things, like we in our evaluation, like we're going to get to know the person kind of like we're not we're having a conversation with them from the get-go. So we're not even thinking about like the first question's never like, what do you, obviously you're making sure like they're coming in for whatever the referral is if they have a referral, but say they're coming in for knee pain, you want to confirm that, yes. But you're the first thing they're getting in to a conversation with them is about them as a person. So, who they are, how their life has been going currently, and how it's limited by, whatever they're coming in for treatment with, and really having like a conversation with them and getting to know them as a person and trying to unravel that, like again, biopsychosocial models. So like figuring out, how many hours of work does this person week? Do they have hobbies? Are they exercising? How, like, what's their stress level, what's their like living environment looking like kind of like their entire life, right? Trying to like figure out, like, get a good picture of that. And then after all those things, then kind of figure out maybe generally like what's their diet look like, what kind of medications are they on, so on and so forth, how long have they been dealing with this pain. We get just such like a diverse description of who the person is, and then we get to why they're coming in, their primary symptomatic complaint. Oh, wow. Okay, so your knee's hurting you. Okay, it's your right knee. Where is it? How much pain do you have? What's the kind of pain? Does it go anywhere else? Then we get into our exam when we look at, okay, we're going to measure your range of motion at your knee. We're going to check your strength. Really good PTs, doctorates now, we're going to look at above and below. We're always looking above and below. We're not looking at the knee. We're going to look at your foot. Most likely there's something going on with your foot and your hip, and we're going to take a look at, can those things be improved? And we're kind of unraveling you as a person and trying to figure out, Patrick and I were just talking about before we recorded, but why did this pain start? There was a point at one time where something wasn't as good as it could be, and over every single day it got worse and worse and worse and worse until like the straw that broke the camel's back, so to speak. So it wasn't like it just showed up, unless it was like a traumatic injury or something like an ACL or like, a motor vehicle accident or a fall or something like that, then that's a different story. But most injuries take time, and they're not just straightforward as it's just this one thing. It's a multifactorial, we call it. It's multiple things kind of overlapped into one. We have pain in a certain area, and we need to kind of figure out what things we can improve to get rid of the area that hurts, relax it, get it stronger, so on and so forth. So that whole spiel, basically, like the point is we're doing such a thorough evaluation with you. And again, like Patrick said, we're trained in all things that, like, not to the same depth as like a medical doctor per se, because it's not as much school and it's not as long as, med school is, but we're able to understand so well like what's going on and what's going to benefit you in that first evaluation when we meet with you. And then on top of that, we take into that whole like social, level of your who you are as a person. What things are you limited by? What makes you happy? What's your life situation look like, and play that into our treatment too, because those are things that, we really can't control that much. We can control when you come in and we work with you and what we do, hands-on skills, and what we're going to work on mobility, and we're going to work on stretching, and we're going to work on strengthening. But the 2 or 3 times, if we're lucky to see you for 30 to 45 minutes each session, is not going to be enough to make you better. And definitely there's all those other things that we can't control, and those are things that we look at too. So I think that makes a really big difference, that we're taking into account those things in your life as well. Whereas most doctors are just going to say, here's a prescription, take this medication at your local pharmacy, and it's going to help get rid of your symptoms. And with physical therapy, that's the biggest thing, is yes, symptoms, but it's getting rid of the reason that those symptoms were there in the first place. So we're correcting the issues and improving really the way that you're moving and the way that you're living and enhancing your life experience versus just trying to mask symptoms and kind of put a band-aid on the problem. So I think that's what I would explain to people, and myself included, before I was a physical therapist now, before I even thought I wanted to do physical therapy. I had some of the same kind of doubts where I was like, I don't know if this is going to help. I'm not seeing improvement in the beginning, but it's again kind of giving it time and letting it kind of set up a really good kind of program for you that works and improving all the things that you have a control over. And then, you really see amazing results like, month, couple months, 6 months before and it's like, wow, I'm doing better. And I'm also more educated than I was when I first got injured and I came into physical therapy. So,
Yeah, and so on that note, even if it was, I mean, hey, there's a lot of wonderful doctors out there. And on that note, even if the doctor is going to assess and you're going to see them for something, a lot of times it's one visit. So that's something I wrote down where I think it's underappreciated, the fact that for a variety of different PT places, you're going to see this physical therapist for like many, many sessions. So they get to constantly work with you. And it's like, yeah, that does take time out of your day and things like that. But, do you want to live with the pain? Or do you want to try and slap a band-aid on it? And this is a big common theme in this podcast and a lot of what we talk about, where giving up that which you want now, for that which you ultimately are going to want in the future, which is going to be sustained health, lifespan and health span, where don't give up. Oh my God, I got to make it to the PT today and I got to go again and I got to go again. And it's going to take time, but at the end, it's going to be worth it. So I wrote that concept of an underappreciation of like chronic visits, that they're slowly working you towards, a better version of you than when you first saw them. But it's that version where I'm assuming as a PT, like when I do nutrition, the idea, even a strength coach and things like that, is the goal is to teach you how to move, to get you and help you move in those specifics. Like for me, to teach you how to eat, to teach you what to eat, that eventually you shouldn't really need me. Like the goal is if you did your job and short of them having another injury or re-injuring themselves, things like that, it's you getting them to, hey, now I'm back and I'm better than I ever was, things like that. The other thing I talked about, one that I love that you talked about, was the idea of, research. And as someone who's a research scientist, a professor, I mean, PhD, my whole 7 years of grad school, it's a majority of it is research. I do research, I publish research, I teach research methods, and the idea would be research. This is where you like research everything generally in your life. That's the type of individual I am. I have an insatiable curiosity. But when it comes to, hey, I have this specific injury, let me research, physical therapists and try and find someone that might specialize in that. I always paint it in the picture, like for myself, when you talk about like the fitness realm, I would like to go to someone who has experience or might have their certified strength and conditioning specialist, that doesn't necessarily qualify them or put them into the same wheelhouse as someone who might be exactly what I'm looking for. But it's just one of those standards that's set where this individual is obviously very interested and they're qualified enough to have passed the certification for the certified strength and conditioning specialist, which I think at one point it was like a 54% pass rate. It's like not everyone passes that, and you need a bachelor's degree in order to sit for it. But pursue a physical therapist and don't be afraid to do the research. I mean, this is your life we're talking about. It's the quality of your life and the pain that you potentially are living with all day, every day, or every time that you go out on a walk or a run or a hike, or someone your kids or your friends want you to play a game of softball or kickball or basketball, and all of a sudden my knee and my hip are constantly bothering me. It's like, like suck it up a little bit and do a little bit of that research to find out, hey, who might I be able to go to that can significantly help me? And I think the other third point that I wanted to talk about was this idea of that approach that you're going to take where you're looking at the individual, and this is what I teach in class, and we talk about from a personal training strength coach or even nutrition, from a holistic standpoint where, and we got into sort of, I know you were using the 2 steps back, 4 steps forward. But that idea of stepping into their past where you're now going to look at, hey, what has been your life like from an exercise standpoint, from a movement standpoint, from an occupation standpoint? Do you sit all day? Are you standing? Do you have a lot of stairs? Are you carrying heavy loads? How are you carrying them? Like all of that stuff is pre-screening, is background, and that helps you set the stage, right? And understand what's going on in that individual's life. And I think another aspect is that one-on-one approach, that you're going to meet this individual, you're going to establish a rapport, and we can get into that whole other concept of bedside manner. And it's not to say like the physical therapy realm in general, but it's one of those allied health professional or medical professional realms where behavior modification, behavior management is extremely important. So it's like you could be the greatest PT in the world, but if you're not very nice and you're very rude to your patients, a lot of patients are just going to shut down and not want to listen to you and things like that. So those are a couple points that I thought of when it came to everything that you sort of opened up about the field and how you treat a patient and things like that.
Yeah, I think it's a really cool field because it's just there's so many things like when you go to school, I mean, you're drinking from a fire hydrant in any kind of graduate program for the most part, and you can relate to that with
Yeah.
your PhD work when we talked about on the first episode. But when you take a step back and you come out and you're like, okay, now I can go and I can look over these things and I can understand them. I can understand much bigger complex systems and ways that relate to the body and do my research. And there's always going to be things like that. Everybody's in a specialty to some degree, so you're always going to have to look up stuff and refamiliarize yourself with things. But you have such a rich like background of the entire human body and like all the different things that could happen and how different things relate to one another. And again, like you said, like there's even like physical therapists that work with like dancers. Like there's PTs that specialize in like everything. Like there's someone out there that is understands what you're trying to do, and especially if you're trying to do it at a high level. And some of those individuals are also doing it themselves. Maybe they were former like collegiate dancers or professional dancers or athletes or what have you. So like Patrick said, there's a lot of really amazing clinicians out there that you can just do a little research, and you can get in touch with them, maybe have a consultation with them and figure out are they the right fit for you? Or maybe you need to go to somewhere else that, maybe they have a friend or they have another person that's within, the health field that they can connect you with. And I just think it's something that like I see it now with I've been working for like 6 months now, and it's just to hear like that people feel better just in a couple sessions is like just such an impactful thing. Like it makes me really just love my job. And it's just the education too, like going a step further and like giving them that education to eventually they're not going to come to us forever, right? That's the goal. They're going to leave. They're going to go back to doing what they were doing before at a higher level even. And we're educating them. Like we're healers, but we're also educators. So we're helping them be more independent in managing their issues that may come up in the future, because it's going to happen, all of us. Like you said, 84%. Like even in school we were educated like 90% of the population, even more than that, eventually is going to have lower back pain. It's like the leading like musculoskeletal ailment in the field. So one day you're going to deal with this, and it's nice to eventually, after you have treatment, to understand like, oh, I could, just as an example, one of my favorite stretches is the open book, right? Opening up that kind of thoracic lumbar spine, like you're laying on your side, and you kind of tuck your leg in, have one leg, your bottom leg straight, top leg's bent, hooked into the bottom leg, and you kind of open up like a book. And like I give this to my patients all the time, because like Joe, when I went to him for treatment for my low back, like it's just, these things are just so powerful. Like it becomes part of your routine as a person. Like it's like the movement hygiene. I love that word. And it's stuff that people can do on a daily basis when they leave you and they get discharged, to be able to just indefinitely be, your body is so resilient. Like people are living 85, 90 years now. Like Kelly Stretz, another great, wrote The Supple Leopard. he made that statement. He's like, your body is designed for like 85 years on this planet. Like, just because your knee hurts right now doesn't mean it's broken. Like, you could fix it. Doesn't
Mhm.
matter if you had knee pain for the past 5, 10 years. Like, you could fix your knee pain and be out of knee pain in the next, couple days. So, don't procrastinate. Don't wait any longer. Like, do your research. Go see a physical therapist. If it's a PT that has a 4-year degree, bachelor's or master's, 6 years or 7-year degree, doctorate, it's all about their experience. If they've been doing it for 30 years, they're just as credible as a clinician. It's not to knock them and say doctorates are the only people you should be going to, but it's just to make the point now that just to allow you guys to understand how much education we actually get as clinicians, as physical therapists, because I don't think a lot of people know it's a doctorate now. And especially with like some programs or problem-based learning where I went at Sacred Heart, and that's very similar to the model of medical school. So we did twice a week tutorials, we called them, and we had 125 cases over 5 semesters in our 3-year program. And those cases were people, they were individuals, and they gave us a case like Patrick comes in with knee pain, and each person would break up, like someone would get anatomy and phys, someone would get biomechanics, I might get examination, and we would all go into our own research and all of the different textbooks and research articles and what have you, and we come back and we'd have a conversation for 3 hours and teach one another in this kind of setting. When COVID happened, we were on Zoom for a little bit, but even in person, and teach one another what we learned before we even learned it in class. So we learned everything. I mean, to the point of like, you're at higher risk for breast cancer if you have a BRCA gene, like random stuff like that you would never even think you would need to know as a physical therapist, and different degrees of burns, and different kinds of adjustments for prosthetics if someone's knee's buckling and they have a um, above the knee amputation or below the knee amputation, like just so many different things that's not just about back pain, but how they all relate because there's so many different scopes. And with that being said, someone who goes to a problem-based learning program just has such a rich knowledge of so many different um, kinds of problems that can relate to the human body, and is just that much more kind of equipped to be able to be like, oh, I've heard of that before. Let me go do my research, and boom, oh, you should go to this person because they specialize in that. This isn't really my field of expertise, but there's someone else who can help you. And I think that's just as powerful if someone can make a referral to somebody who can help you. Because again, that's going to eliminate the time of you getting bounced around to different people to eventually find the right one for you. And that's the biggest thing, is you need to find the right clinician for you. And anyone, I'm sure Patrick, you can say that too, with nutrition and with your work too. Like, you need to find somebody who understands you as a person, your goals, like you said, someone who has their certified strength and conditioning specialist. You're an athlete, you want to go to somebody who understands how to work with athletes, and that's very, very true and very powerful. And it's also going to help them make a plan of care for you that's going to help you not just get back to your prior level of function, but keep crushing your goals and moving forward.
Yeah,
So
so for me, obviously, a big term that we use on this podcast a lot, and just in our general interaction, is mindset. And, the big aspect of when I'm looking for someone, it would be, I want to pursue someone that has the mindset to not just make me not hurt, but make me, not hurt in the way that I am now, like, ready to tackle and take on the world, like, because that's just my general mindset. Like, whatever I do it to the best of my ability, and I'm extremely competitive, and I'm constantly looking to challenge myself physically and things like that. So that mindset, I think, is really, really, really big. And I think a big thing that you touched on is, with that education, this is where, I'm constantly going to tout, if hey, I mean, we're talking all about going and finding a physical therapist and things like that. If anyone's interested in becoming a physical therapist, I'm always going to tout the horn of, I mean, I direct an exercise physiology program at St. Joe's University in Philadelphia. I highly recommend, pursuing an ex-phys degree as an undergrad, because we're going to teach you everything there is to know about human movement and the physiology of fitness and exercise, and the variety of the fit principles, frequency, intensity, time, type, and how all of that plays into the health-related physical fitness components, the physiology towards performance, fitness, and then, or the lack of health and pathological disease state. And when you then get into everything now in that doctorate of physical therapy, I mean, I have a lot of my research students are physical therapy students. So at my school at St. Joe's, I'm blown away when I've first started, how robust the research faculty are, and how much research they actually do. So I get a lot of my research students as the DPT students, but I mean, you're doing clinicals, you're literally working on research. They're like literally palpating from day one, and like for the rest of their entire academic career, it's like manual like it's every day hands on. It's just it's mind boggling. It's kind of like in the PhD, once you get outside of the classwork, how much you're doing hands on in the lab. And then I see in the physical therapy, world, in the training, it's just so much more robust of a hands-on, learning, experiencing, problem solving, and things to that nature, that it's just remarkable. And they go out on clinicals, and they go out on rotations, and they try a bunch of different things. And there's tons of case study, and it's like you're literally learning all of that in that. That's why they are, like the doctorate of, or the doctor of physical therapy. So it's just such a robust amount of information. And I think on to a testament to the physical therapy or the physical therapists, a lot of the programs, it's you'll hear, oh, you're going for this amount of time, and not that many programs are going to be fall and spring. It's, you're going like year round. So you're doing summer, and they're cramming a ridiculous amount of information that you're going to learn and absorb over the several years. So, kudos. I mean, I know that the academic journey, I was in college for 12 years and I'm still there teaching it, but, kudos, Dr. Stegmann and all the PTs out there. And I think a big part of what we were talking about is extremely important on the research aspect, but at the same time, hey, you're making a plug, and here's what we'll get into, and then we can sort of wrap it up. One thing that I wanted to talk about was, research, find the right PT, someone that jives, or vibes with you, and what your goals are. It's one of the first things I teach when I teach certain classes. Hey, when a client comes to you, the first question is, hey, nice to meet you. What are you doing here? What are your goals? And then we can go over a course of action, stuff like that. But after that, once you do start seeing them, let's get into a little bit this idea of accountability, where on average, and I've only been to a PT personally once in my life, it was for an IT band. And with that, so let's say on average, obviously that's a very blanket statement. How many times a week would someone see a physical therapist?
So it's
In an
interesting.
outpatient, like a typical
Outpatient.
outpatient.
So it's hard to say where I work right now because of the compliance standards and things like that. And within a hospital, it's usually just based on the doctor's referral. So if the doctor refers, let's just say generically, what I've been seeing pretty more often than not is 12-week referral, 12-week script, so to speak, that you can come in for, how long it lasts. And that would be from the day that you start physical therapy. So for your evaluation day, and it depends. I more often than not see 1 to 2 days a week. Some come in with 2 days a week. And then again, like usually, so when we set that plan of care up, it would be like 2 days a week. So if they give you a range 1 to 2, usually you put in the 2, 2 or 3 days a week. But for generally for like most PT clinics, I would say if I had to make an educated guess, probably 2 days a week would be my best guess. It depends what it is. If it's surgical, obviously it's probably
Sure.
going to be more frequent. Go ahead. What were you going to say?
Yeah,
Sorry.
no. So with that, you're setting that stage. So here's something that I want you to get into, and feel free if you want to go on a little rant. And a big aspect of, if you do have these ailments, it could be from something that you either did wrong, like you just had an accident. I'm blown away. There's a stat in one of my textbooks that I talk about where a high propensity of musculoskeletal injuries are simply due to just overreaching. Where like I'm sitting in a chair and it's, hey, you want me to grab something, and I like overstretch and then I pull a muscle, or I then tweak that muscle, and then for the next 3 weeks I keep tweaking it more and more because I'm improperly carrying my bag and all these random things. But a person comes to you, let's say they're going to see someone in an outpatient for 2 days a week. The idea that I want to relay, and I'm sure you can harp on it, is you can't expect to show up for the most part and see that PT twice a week, just like a strength coach, just like, a nutritionist, whatever, and expect those 2 days to solve all of your problems. It's going to be like when we get into the nutrition world, and we've got a couple of things lined up for some podcasts on nutrition. The idea is we want to follow a lifestyle, like maintenance diet plan or diet. Like we don't want to be dieting. We want to put you on a general diet that you last for your entire life with. So as an individual is coming to the PT for those, 2 days for a week for several weeks, I know more often than not, I see it in students, I hear it from PTs, I see it in nutrition, all these different things, that they'll come and they'll do a 30-minute session. They might be there for an hour and they'll do whatever they do. And then, all right, I'll see you next time. And they don't do anything until they see you next time. And then they see you next time and they don't do anything until they see you next time. And then you add it up and it's, even if it was 12 weeks, it's like, that's 3 months. Like you only worked out 24 times. We're giving you prescriptions. So touch on that a little bit, where you're giving them prescription, because I've never met a PT, and I work with them. I've never been to a PT that did not provide some type of prescription for you to do between now, this session, and then the next session that you're going to see me.
Yeah, and I think so. There's a couple things I want to say, but I think the first thing is, so I've been a victim of that for sure. So when I used to go to treatment, I would go in, but the benefit for me was like exercise for the longest time. I probably started working out and I haven't stopped since I was like 15, maybe I'd say, like really getting into like structured strength training and stuff. So I think the problem with, so let me say I'm a victim of this too, and I've been there, so I don't want to
Same
sit
here.
on my high horse. But I think the benefit is that I've been exercising for such a long period of time, so I was already like working out, and we can get into our minimums. You can plug the minimums for the ACSM or whatever you want to use for your, let's just say, however many minutes a week. For me, probably like 5 days a week for 60-minute sessions. That's definitely going to probably be above average. But
Yes.
to tack on my home exercise program and the stuff, my like recovery prescribed exercises from my therapist at the time, I was only doing it when I would go to PT treatment, and then I would just go back to doing the things that I want to do in the gym, squat, bench, deadlift, whatever, ego lifting kind of thing. And I wasn't getting much better and now just recently, honestly, it's taken this long where now I'm a clinician. So like now I'm doing a lot of the stuff because I'm a guinea pig on myself.
Mhm.
To when I go and demonstrate like a single leg deadlift to a higher level patient in the clinic, I better be able to do it. In my opinion, I want to be able to do it and show them how to do it with good form, good stability, good balance, not like shaking and feel like I'm going to fall over. And like that's something that I've had to do to rehab my back. So the way that I do those things now is, yes, I'm prescribing them in the clinic for certain people, but I'm also doing them as my warm up. And I think that's the best way that I would help people integrate it into their lifestyle. And now that calls for you to go and join a gym or exercise on a pretty much regular basis, which Patrick and I have always been advocating for all of you to be
Mhm.
doing. Body's made to move. You have to move. Movement's healing. Without,
Stagnation's bad.
yeah,
Right.
without moving, like we're going to die, So if you just lay in bed all day, like eventually your heart's going to stop. All the processes in your body are going to stop. Movement is what keeps us going. So I think the biggest culprit is most of these people just aren't exercising. Like their regular daily routines are just work, and they consider their work and work related activity and structured exercise, which I would let you explain, but those are completely two different things. Like if you have a intensive job, like you're a construction worker and you're picking up things and lifting them all day long, is much different than if you're going to the gym and you're doing something structured that is meeting the things. Maybe you have goals, but even more importantly, if you have like rehab needs where you need to work on core strength, or you need to work on glute strength, or you need to work on more quadricep control and for your more of your thigh muscles to get rid of your knee pain, whatever it is, like just because you think that you have a rigorous job, that's not going to help you 5 days a week and then you come to PT twice a week to do your exercises. You have to do those things for how many times a week they're being prescribed for, again, like Patrick said, the fit principle, frequency, intensity, type, time. How long are we telling you to do it for? How many reps? How many times a day? How many days a week? and also be progressing them as we're progressing your stuff while you come to treatment twice a week, because you're not going to be coming to treatment 5 days a week. Like Patrick said, we only see you twice. And the way that you're going to build strength takes time. And that's what gets people to be permanently better, is over a prolonged period of time and doing it like 3 to 5 days a week minimum. So I think the biggest problem is most people aren't doing any physical activity. So they think that coming to physical therapy and doing physical activity there is enough. And then just doing their exercises with us, like guiding them, is enough. When in reality, that it's actually more important, if you're not active already as an individual, to be doing those things outside of PT, because you're doing nothing, you know, during your daily routines and tasks, versus somebody who's like already in the gym 3 to 5 days a week, and then maybe they can get by a little bit more because they're already exercising, they're already moving, they're also working. Now they're coming to PT twice a week and they're only doing their exercises and prescription and plan of care there with us, but at least they're still moving and more active and more structured throughout the week. So yeah, you're right. And most people aren't there. I've gotten more people lately, and I don't know if it's because of my personality, if I give off like the fit vibe or whatever to people, but they
I
always
hope
like that.
so.
Oh yeah, I'm doing my stuff. I'm doing my stuff at home. I don't know if they are or not. I don't go home with them, but um, some people say it like they haven't been doing it, but more often than not, most people say that they've been compliant, meaning that they've been following their home exercise program. So I would say yes, I agree with you. Again, you're not going to be coming to physical therapy forever unless you do cash based and you have the money to blow, and your insurance isn't going to cover forever. That's a whole
Mhm.
nother thing we can get into. Insurance is terrible, but um you want to make use of your time, like we always talk about on this podcast. And more importantly, if you're only coming twice a week with us, you want to make sure that the things you're doing with us are things you can't do at home and are things that we can make sure you're doing correctly. So you can then take that a step further. And if wherever you're exercising, you use those as like your warm up, your prehab, so to speak, and you do them on your rest days. And you want to make sure you're moving more educatedly and you're moving better, right? That's why you're coming to us. We're movement experts. So that's the most important thing. Yeah, you're going to feel better if you come to us and you do your stuff with us, but again, it's like medication, right? It's only going to help you while you're doing it. The point is to make it a part of your life, like you said, Pat. And that's what's going to help you stay better permanently. Once you stop taking the meds, pain's going to come back. Once you stop going to PT, you do nothing else to follow up with it and make sure you're moving better. Well, you're going to go back to your old patterns and movement, and unfortunately, you're not going to get better. So yeah, it's huge.
Yeah, so right, like for the PT, everything we're giving you resources are only as good as your willingness to use them. How many PTs will like cut you some TheraBand, and it's like you've got to do these stretches. We'll give you two different, we'll slowly progress it to, a more dense or like a more durable, a TheraBand that's going to equate to a greater load that you're going to have to overcome. I'll give some insight in. This came up in I think the first day of my one class where it was like foundations of exercise science, and I asked the question, who in this class, who should be moving? And the idea is, well, everyone should be moving. If someone's paralyzed from the neck down, guess what they have that individual do? They strap them to an exercise bike, and they stimulate their legs to move. That which is work develops, that which isn't waste away. Stagnation is really bad for the body, which then leads to, not so good things for the mind, for the brain, for all these different things. So I then had a student who randomly said, well, what if you have like a construction worker, like a pretty fit construction worker? So I think two things, because you kind of brought that up. One, when it comes to the resistance training world and really the cardiorespiratory, so you got like the cardio world, and then you've got the muscular fitness, so the resistance training, muscular endurance, muscular strength. We'll just lump them all together. The idea for both of those is that fit principle. So if you want to adapt, so adaptation is one of my favorite terms in the physiological world, especially exercise phys, you need to cross a certain threshold. In order to overload the body, the physiological, musculoskeletal, the piezoelectric effect, like when you apply a load against your bone's going to want to reciprocate and, like grow longitudinally to thicken based on the force of the load that you apply. So the idea would be, if you don't cross a load, and hey, there's a ton of construction workers that have to pick up heavy things, or someone works in a factory and, I pick up a heavy thing. And it's like, is it heavy enough? Or you then get at fitness intensity. So the intensity, yeah, but you then have one big aspect of what drives intensity in a resistance training bout, and that's rest. Where if I'm doing construction and it's like I'm picking up something heavy and then I put it down and it's not like 10 minutes before I pick it up again, you have one aspect of, well, the totality of the work that you did given the rest period combined, there was too long of a rest period for you to really elicit the greatest overload, to warrant like significant gains and adaptations that your body's going to want to take on. The other aspect, so let's say you were doing enough of a load, high enough intensity, you do it every day, it's your job, whatever it might be. The other aspect would be just because you're doing that doesn't mean you're doing it correctly. So that's the other big giant thing that when I teach like exercise testing and prescription, it's like technique, technique, technique. So I have my functional movement screening, FMS level 1. I like it as a wonderful screening tool. Anyone who doesn't like it, it's like, hey, I feel about it somewhat similar to the BMI, where it's like people are like, oh my God, BMI doesn't take into account, muscle mass. And it's like, well, yeah, but show me another way to assess a potential like screening tool of whether I should look into someone's body fat percentage or not. It's like BMI is a wonderful tool for that. Is it applied to everyone? No. But the technique aspect, I think that's another big aspect where you can have an extremely demanding job. That doesn't mean that when you're doing it, you're going to do it properly. I mean, that's one of the benefits of a personal trainer or a strength coach is they're going to be a coach, and that's ultimately the type of PT that I'd want to go to. Like I have a ridiculous amount of energy. Everyone I know, it's pretty hard. My advisor, Sean, Dr. Hearn, he probably had an energy level. Maybe I emulate, but he's a wonderful mentor to look up to for that energy level. But I'd want to go to someone like you that has that energy level, that has that mindset. But I think it's underappreciated how the physical therapist, is not just going to provide you with the prescription, but they're going to literally teach you how to move. They're going to teach you how to properly do the technique, how to sit at your desk. And that's where we can have a guest on eventually and get into the whole occupational therapy world. But, we're looking to, it's the whole mindset of, hey, I don't want to put a bar on your back if you don't know how to move. You don't know how to squat. Why would I put a bar on your back if you're already without a bar, do not know how to squat down, which is something that we were, like literally born out of the womb. You look at any like toddler or, let's just say toddler, and they have like the greatest squat technique of all time. And we slowly train it out of them, so that technique aspect, as well as, sort of understanding that you need to keep up with it, like we were just getting into. There's a quote I wrote down: accountability breeds responsibility. Like you need, as Stephen Covey, you need to be accountable for what you're supposed to trust, what you're supposed to do when you're supposed to do it. And that is between session 1 and session 2. Do you have any stretches to do? What boggles me, and I'm on a small rant here, Tyler, is most of that stuff, when you go to a PT, yes, they can become specialized, like, like cardiac rehab, they're EKG special, like you can go in the gamut, but a majority of most of the listeners, for a majority of the PTs that they're going to go see, a lot of the prescription that you're going to get in between the sessions, because like you said, you're going to have tools and techniques that cost, equipment that's very expensive and tools and techniques that you're going to do during the session, but then they're going to prescribe you something in between. For the most part, my wife's gone to multiple PTs and all the prescriptions are relatively simple. Simple doesn't mean easy. I read a really good thing, a quote that said, I think it was John Maxwell, said, one of the greatest challenges of leadership is leading yourself. So like you were saying, you don't want to just preach, because it's much easier to teach someone than it is to show them. So like you were saying, and that's something that I would generally, it's just who I am as an individual. How I act is I want to practice what I preach. And that's kind of along the lines of what you were saying. But yeah, I think from that standpoint, the person needs to take that accountability and this is a common theme. This is sort of a good way to sort of, I guess, wrap it up. Of everything we talk about is, you know, personal accountability, personal accomplishment, you know, taking action. And that action is, hey, maybe you have an injury, go find a PT. And then when you do find one, when they tell you you're supposed to do something, I mean, this person is dedicating their life to understanding how to help your injury and make you, you know, pain free and more mobile. So do the things, you know, that they're telling you to do. Since you get to see them, don't just think they can fix it in one session. You're going to be there for several weeks. Leo Tolstoy said the greatest warriors are patience and time. Have the patience to sit through what they're telling you, do the exercises, have the patience to do them, do the stretches. And I think the other big thing with PTs is when you go there, they're going to have you stretch, and it's not going to be just like a 5-second stretch or 10-second stretch. Hey, you're going to hold that for 20 seconds, 30 seconds. You know, there's really no great benefit past 60 seconds. Then you'll rest, and then you'll do it again. And then you'll rest, and then you'll do it again. And then we have a whole bunch of other stretches. And then we're going to add some weights, and we're going to have some strengthening aspects of it. And it's like, oh, wait, when I go home, what if I could just do one of them? You know, they want me to do 5 reps. And it's like, what if I just held the stretch for 20 seconds? Like, am I good? You know, and it's like, no, in general. But that gets back to this whole mindset aspect. So there's my rant. I'm sorry. But yeah, anything else?
No, I think it's a great conversation, and I think it opens up like another door of different things that we could talk about. It's just kind of a brief overview of physical therapy, and I mean, you talked about like pediatrics is another thing that you can
Yes.
specialize in too, and we learned about that in school. It's really cool to like have a conversation and think of all the different ways that, and again, like not to just like plug physical therapy, but just like the health field is so amazing. Like there's so many great people in this field, and there's so many different experts that you can go to help you with it, whatever kind of thing you're going through. It doesn't have to be musculoskeletal, but like again, like we said, anything relating to the body, psychosocial, stress, whatever it is in your life. And I think another really good conversation eventually would be for us to get into like the benefit of having that exercise science background was something I was going to touch on
Right.
before, because that's something that I went to Mercy College for my bachelor's when you were teaching there. Um, for 4 years, and that helps so much tremendously just to understand that whole background of, again, what we're prescribing is therapeutic exercises for the most part, and to understand, in school that's actually a very small portion of what we got more in our clinical experience where we were learning that for prescription, but in school we learned so much more, so we didn't have as much time with that. And I think to have those 4 years prior really was a good stepping stone to kind of get into the doctorate and really finish it off. So that would definitely be a very good recommendation. Like you said, ex-phys, exercise science, something relating to the body would be very beneficial before you go and get your doctorate in physical therapy. So
Heck yeah. Come on in. St. Joe's 4-year exercise phys. But so with that, again, we talked all about that, and I'll say it is a plug for physical therapists. You know, it is a specialty. It is a specific niche that can help. Like we started off the podcast with, 84%. You learned up to 90%. I mean, that's almost everyone that you'll ever meet. Is 90 out of 100 are going to have low back pain at some point in their life. And how many others? That's just one ailment. Like we were talking about that before from a musculoskeletal standpoint, that's just one aspect. So there's a ton of other little ailments and things like that. And it's just what we're trying to do is give you that insight. We've got Tyler here, Dr. Stegmann, wonderful resource. So it's just, consider a physical therapist, and look up any questions. I mean, feel free to reach out, leave any comments about any physical therapy questions or anything like that. And I know Tyler would be more than happy to answer those or put you in the right direction if he doesn't know the answer or things like that. So anything else to add?
yeah, absolutely. Don't be shy and let us know too, even if you don't have any questions, but maybe you're more interested in learning in a specific topic. I'd be happy to, look over the content for my coursework that I had and dive into that with Patrick and have a really informative conversation about it. And also for us to maybe get other guests in the field, if you want us to bring on, like you said, occupational therapists. I have a ton of connections now being in the field, and Patrick does as well with being a current professor. So definitely let us know, post them below, and we'd be happy to try and set those up for future topics to talk about. So, and I know we were going to just briefly mention our 25-day challenge too, which we hope that you guys are enjoying, and that will be posted in here for you. If you didn't already listen to episode 7, definitely pop over and take a listen to that, because we dive into that and have a good conversation about our 25-day challenge at Valued Pursuit and what it has entailed and what it offers and how that can benefit your life as well. So,
Yeah, and how to start taking some action, have some accountability, and through that accomplishment, building a lot of that self confidence and things like that. So, very appreciative. Thanks for listening. Thanks, Tyler, for letting us pick your brain. And I look forward to the next one.
likewise, brother, it's been a pleasure, and thank you for your time, and thank you for listening.
Thank you for being here and taking a step towards growth. As the saying goes, change is inevitable, but growth is optional. We look forward to sharing more expertise and content with you, and we want to hear from you about what topics you're interested in learning more about. Please share your thoughts in the comments below. And if you're enjoying this experience, please like, subscribe, and share with others who could benefit.
Our goal is to grow the show and bring on more valuable guests to provide relevant content for your life. Thank you for joining us on this mission to spread knowledge and connect with people around the world. The Valued Pursuit podcast and content posted by Valued Pursuit is presented solely for general informational, educational, and entertainment purposes. The use of information on this podcast or materials linked from this podcast or website are at the user's own risk. It is not intended as a substitute for the advice of a physician, medical, psychotherapist, or any other qualified professional, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical or mental health condition they may have, and should seek the assistance of their healthcare professionals for any such condition. You ever have a vision? Something you see play out before it happens? They say that the scariest thing in life is not growing into your potential, not recognizing the person you were created to be. We are on a mission to help everyone on this planet chase that version of you, your most fulfilled self. Created here in the USA, Reinvent Co. is now releasing their one-off hoodie in a full zip design, premium quality fitted to your physique to show you are chasing greatness in all aspects of life. Wear a garment that shows your potential evolving over a lifetime, and become a part of a brand where humans connect to knock down the obstacles they face for endless refinement and continuous improvement.